Hi, my name is Marissa Park. I'm a dental hygienist and Verse Ambassador. Not too long ago, we talked about coconut oil pulling, and I got two Verse Ambassador dental hygienist friends to try it with me. We switched for 10 minutes, and then we talked about our experiences. You're in for a real treat today. We are diving deeper into oil pulling, but this time it is with ozonated oil pulling solution. So what is ozonated oil pulling? Here's a water molecule H2O. Ozonated solution has an extra third wheel that attaches to viruses, bacteria, fungi, etc. and kills it. The oral cavity appears as an open ecosystem with a dynamic balance between the entrance of microorganism, colonization modalities, and host defenses into their removal. To avoid elimination, bacteria needs to adhere to either hard dental surfaces or epithelial surfaces such as your gums. The oral biofilm formation and development and the inside selection of specific microorganisms have been correlated to the most common oral pathologies such as dental caries, periodontal disease, and periimplantitis. The mechanical removal of the biofilm, adjunctive use of antibiotic disinfectants or various antibiotics have been the conventional methods for periodontal therapy. There are three fundamental forms of application to oral tissues that can be applied: ozonated water, ozonated olive oil, and ozone gas. Ozonated oil has the capacity to entrap and then release ozone. That's an ideal delivery system. These forms of applications are used singly or in combination to treat dental disease. The different clinical application of ozone therapy in combating the dental disease and their treatment modalities are elimination of bacterial pathogens, periodontal pocket disinfection and bone disinfection, prevention of dental caries and odontic treatment, tooth distraction and sensitivity, pain and infection control, accelerated healing tissues regeneration, controls bad breath, teeth whitening, and many more. So think of ozone oil pulling as simply a super duper supercharged form of oil pulling that is way more excellent than that of just a regular oil pulling without ozone. Oil pulling works far better than mouthwashes because oils are far better at penetrating all the tiny crevices and small areas around your gum tissues and teeth. The ozone rides with the oils, reaching every microscopic gum line, tooth crack, or fissure anywhere in your mouth, delivering bacteria-killing ozone to all those areas as you swish the oil around your mouth each morning. The best way to do home ozone therapy procedure is oil pulling with ozonated coconut or ozonated olive oil. Oil pulling, also known as kavala or kandusha, is an ancient Ayurvedic dental technique that involves swishing a tablespoon of oil in your mouth on an empty stomach for around 20 minutes. This action supposedly draws out toxins in your body. It primarily is to improve oral health, but also to improve your overall health. So this is the bottle that I tried, and I took about 1 tablespoon for 10 minutes. So what are the ingredients in this bottle? It has coconut oil, sesame oil, sunflower oil, and peppermint oil. So you take 1 tablespoon and swish for 10 minutes, and then you spit it out. They say usually 20 minutes is better, but when I was getting close to the 10 minutes, my saliva was filling up, so that 1 tablespoon of oil solution became more solution in my mouth, so I couldn't do longer than 10 minutes. So you take 1 tablespoon of the ozonated oil solution, so what does it taste like? Coconut oil, sesame oil, and the mint. I can really taste the mint. I think the mint really helped a lot in the solution. And if you ever smelled ozone before, it has a certain smell like gas and stuff. So you can taste it a little bit. So it's not as appealing like regular coconut oil, but you can actually taste the ozone in the solution. I think that's what makes the difference, right? It was infused in the coconut oil. Would I want to do this more than coconut oil pulling? Most likely. I personally like oil pulling, and I think it works better than mouthwashes because oils are far better at penetrating all the tiny crevices and small areas around your gum tissues and teeth. If you ever had a jar of coconut oil or leak, you know how coconut oil gets into everything? It finds even the smallest opening to work its way through. And mouthwashes, I don't like it because it could be acidic, it can cause dry mouth, and it can stain your teeth. While coconut oil, it can help whiten. So I choose coconut oil pulling, and that's a good base because it's simply the best oil that in performance, and it doesn't taste bad. Some studies have shown when you infuse coconut oil with ozone, it is creating the oil with outstanding penetration and ozone carrying capacity. The ozone rises with the oil, reaching every microscopic gum line, tooth crack or fissure. Anywhere in your mouth, it's supposed to deliver bacteria-killing ozone to all those areas as you swish the oil around your mouth each morning. But because ozone is a gas, it might not last that long in the bottle, so you're not sure how much ozone you're getting. So what is the verdict? I think oil pulling could be helpful in certain cases, such as when you want to use something that's an alternative to mouthwash for reducing the presence of bad breath due to microbes in your mouth. Just be sure to keep in mind its limitations and possible risks, and continue your normal brushing and flossing routines in order to prevent the development of things like cavities or gum disease. Thanks for spending some time with me today. I hope you like this information. To see more Burst TV videos, make sure to hit that subscribe button. See you next time.